Welcome back, Outlaws. On today's episode, we're going to be discussing canine distemper. This is Winona, and this is her story. So stay tuned. After losing both of our beautiful girls, just 3 months apart, my beautiful sweet girl Lucy, from liver cancer at 13 years old, and my dear sweet Bindi, at 6 years old, from a hereditary disease called von Willebrand's disease that Dobermans get. Tucker found himself alone, confused, and depressed, without his big sisters to show him the way or anyone to play with. It was going to take some adjusting to get used to, and I must admit I was feeling the same way. But then one day, a few months after we'd lost our girls, we were made aware that there was another Doberman that needed a good home that was being housed at the Humane Society.
Hi, cutie pie. What are you doing?
This is Winona, and after seeing her in that cage, we had to get her out of there. But there was an outbreak of distemper, and unfortunately, she had contracted it while she was there. She was held in quarantine until deemed safe to go home with us, and then that's where her journey begins. Unfortunately, she was never vaccinated, which allowed her to be susceptible to the distemper virus. After all of her vaccinations were up to date and her quarantine period was finished, it was time for her to go home with us and start her new happy life. When we first brought her home, her symptoms weren't really that bad. She had a small loss of appetite, and she was really kind of tired. But then we noticed that she was starting to twitch and have strange movements like this here. After researching, I found out that symptoms can take about 3 months to fully develop, and sometimes up to 6 months before they dissipate, and some of the symptoms never go away throughout the dog's life. This jaw clicking that you see here is another symptom of the distemper virus. So what is distemper? Distemper is a highly contagious viral disease of domestic dogs and other animals such as cats, raccoons, foxes, wolves, coyotes, skunks, mink, ferrets, and bobcats. Canine distemper is spread through direct contact or airborne exposure, rather like the common cold in people. When an infected dog or wild animal coughs, sneezes, or barks, they release aerosol droplets into the environment, infecting nearby animals and surfaces like food and water bowls. Pregnant mothers can also pass along distemper to their unborn puppies through the placenta. One good thing is that the virus does not last long in the open environment and can be easily destroyed by most disinfectants. The bad news is that distemper-infected dogs can shed the virus for up to several months, putting other dogs around them at risk. Distemper is usually fatal, and dogs who survive usually suffer irreversible nervous system damage. The dog's immune system may be able to fight the infection in some cases, but in others, the infection may progress to neurological effects such as seizures and tremors. There are 2 stages of the distemper infection. The first symptom of stage 1 in dogs is usually watery to pus-like discharge from the eyes, followed by a fever, loss of appetite, and clear nasal discharge. Most dogs develop a fever approximately 3 to 6 days after being infected, but the initial symptoms depend on the severity of the case and how the patient reacts to it. In general, the symptoms associated with distemper in dogs during the first stages of the infection are fever, clear nasal discharge, eye discharge, lethargy, anorexia, coughing, vomiting, and diarrhea. If a dog infected with distemper survives the acute stage of the illness, they may also develop hyperkeratosis of the paw pads and nose, which gives distemper the nickname hard pad disease. This distemper symptom causes the pads of the dog's feet to harden and enlarge and is uncomfortable. In late-stage symptoms, or stage 2, some dogs develop neurological signs as the disease progresses and attacks the central nervous system. These signs are particularly upsetting for the owners and could be really upsetting. In this case, we thought Winona was starting to have seizures. But fortunately for us, we found out that she was just dreaming, because if she was having a seizure, we wouldn't be able to wake her up.
Winona.
By calling her name,
Winona.
we were able to stop her from kicking and having a bad dream. We were thankful for this. There is no cure for canine distemper. Veterinarians diagnose distemper through a combination of clinical signs and diagnostic tests. Once diagnosed, care is purely supportive. Veterinarians treat the diarrhea, vomiting, and neurological symptoms, prevent dehydration, and try to prevent secondary infections like pneumonia. Most vets recommend that dogs be hospitalized and separated from other dogs to prevent the spread of the infection. Some people may ask the question, do I really need to vaccinate my pet? And the short, quick answer is yes. Canine distemper is entirely preventable. There are several things you can do to prevent distemper in dogs. Make sure your puppy or dog gets the full series of distemper vaccinations. Keep distemper vaccinations up to date throughout your dog's life and avoid any gaps in vaccinations. Keep your dog away from infected animals and wildlife. Be careful socializing your puppy or unvaccinated dog, especially in areas where dogs congregate, like dog parks, classes, and doggy daycare. By following these steps, you can keep your dog safe from distemper. If you have more questions about distemper in dogs, talk to your veterinarian and call your vet immediately if you suspect your dog might be showing symptoms of distemper. Tucker's happy again, and we are too. Now he has a little sister to play with and keep him company, and we hope Winona is happy as well. Now we'd like to share some tips on some of the things we found useful to help Winona out. Because of neurological damage and loss of muscle control, she was experiencing trouble eating, so we alternated dry food and wet food so that she could exercise her different muscles when eating. This seems to have helped her quite a bit. Also, because of loss of muscle control, she was having trouble drinking out of the bowl. She couldn't quite get it out of the bowl with her tongue, so what we did is we trained her to use the spigot. You can see that her tongue is getting that water right now, and she's doing a lot better drinking water. This really works for her as well. It might be something that might work for you too if your dog is experiencing the same issues in drinking. The other benefit to this is that you don't have a water bowl sitting around with water in it that raccoons or skunks that could be potentially infected with the virus could drink out of the bowl and infect your dog as well. Another thing was foaming at the mouth. This is another symptom that dogs with distemper suffer from. What we were able to do with her is get her to let us wipe her mouth down. We wipe her teeth down every time she eats, and that helps eliminate a lot of this foaming at the mouth. It's slowly getting better over time. After speaking with other owners of distemper dogs, these dogs tend to have really bad dreams. We're so thankful that they're not seizures. If it was a seizure, we wouldn't be able to wake her up. If your dog's having a seizure, move everything out of the way and don't touch it because you potentially could be bitten.
Winona.
We're able to help her by waking her up and letting her know that everything's going to be okay. This really seems to help her as well. As far as the tremors and twitching goes, the only thing that we've been able to do that gives her some kind of comfort and relief is to make sure that she has a really nice padded area that she can lay down so that when she moves, she's not on a hard surface. We're kind of not thinking that we want to put her on drugs for this, and we'll just see how it goes without medication. Another thing that we noticed was these dogs have some stanky breath, and I'm not talking just your regular bad dog breath. This distemper has a certain odor to it, and after talking to other owners that have these dogs, they say the same thing. But she's my girl, and I love her anyway. Stanky breath and all. That concludes today's video. I hope it answered some questions that you may have had on canine distemper. If you plan on adopting any pets, please check out your local humane society. There's lots of animals there that are deserving of a good home. On behalf of Winona and Tucker, thanks for watching.